Can you just give us the latest figures on how widespread this India variant is in the United Kingdom?
Well, in total, we've seen just over 1,300 cases of this Indian variant. It is becoming the dominant strain in some parts of the country, for instance in Bolton and in Blackburn, it's there in smaller numbers, much lower numbers in other parts of the country. One of the advantages we now have compared to the past, compared to December when we saw the Kent variant coming up, is that we have the vaccination programme, as you mentioned, but we also have this incredible testing and surveillance system. So we can see these cases even though the numbers are really quite small at the moment, which means that we're able to take this cautious step forward tomorrow and continue on the roadmap whilst monitoring this very, very carefully and taking specific action in the areas where we can see the prevalence of this new variant, like Bolton.
Talking about the surveillance system, so we can really monitor how this new variant moves. So what does the data show us? We were told on Friday that it's likely to be more transmissible, but the vaccines do seem to be working against it. Is that still the case?
Yes. So there is new, very early data out from Oxford University, and I would stress that this is from the labs. It's not clinical data, and it is very early, but it does give us a degree of confidence that the vaccines work against this Indian variant, but it is clearly more transmissible and has been spreading fast in the groups where there's a cluster. And that means that we can stay on course with our strategy of using the vaccine to deal with this pandemic and of opening up carefully and cautiously, but we do need to be really very vigilant to the spread of the disease. And the metaphor the Prime Minister uses is the right one. We're in a race between the vaccination programme and the virus, and this new variant has given the virus some extra legs in that race, but the vaccine will still, we have a high degree of confidence that the vaccine will overcome. And so the main message I've got for everybody this morning is get vaccinated. If you're in one of the eligible groups, come forward and get a jab. In Bolton, where we've seen a number of people in hospital with this new Indian variant, the vast majority of them have been eligible for a jab but not taken the jab. So if you're eligible for the jab, if you're over the age of 38, please come forward, because we know that the jab protects you, and we know that with a high degree of confidence that the jab will have an effect against this new variant too.
What I guess I struggle to understand, or some others might struggle to understand, is you say there's a high confidence that the vaccines work against the variant, and I accept your point that the vast majority of people in the hotspots in hospital are those who are unvaccinated. But at the same time, more than 56 million vaccine doses have been given out. The vast majority of people over the age of 50, people in the most vulnerable groups, have had at least one dose. Why should we be talking about even June being blown off course if we know that the vaccines work and so many people have been vaccinated? Like, who is going to be in the hospitals?
Well, the answer is that because this variant can spread even faster than the Kent variant that we saw, and we saw what happened with that in December, it means that if it gets out of hand, we'll have a very, very large number of cases. And so even with the protection that the vaccine gives you, that is, the vaccine protection is very high, but it is not absolute. 97% protection against dying from COVID is fantastic, but it isn't 100. And so we do need to make sure that we don't get that total, that explosion in cases. So we need to be cautious, we need to be careful, we need to be vigilant. And we've said at each step, we will look at the 4 tests that we have. We assessed those last week for the tests, for the move that we're making as a country tomorrow. And our assessment was all 4 are met. The 4th of those 4 tests is whether a new variant knocks us off course. And we'll of course be assessing that over the weeks to come, and we'll make a final decision for the step 4, which is the biggest step on the roadmap, we'll make that final decision on the 14th of June. So we always said we want this to be cautious. We really want it to be irreversible. New variants are one of the biggest risks to this opening. Because of the speed of transmission of this one, it can really spread like wildfire amongst the unvaccinated groups. Hence, we need to get as many people vaccinated as possible, particularly in those who are most vulnerable to ending up in hospital.
Yeah, listening to what you're saying there, the spread is clearly something that we're still very worried about. And even though the vaccines work, they may not work for everybody. Tomorrow,
yes,
of course,
it's because of a law of large. Because of a law of large numbers. Even though the vaccine gives you that huge amount of protection, it is, if you get a very large number of cases, that clearly has a knock-on in terms of hospitalisations.
So some people who've been vaccinated, frankly, could still end up in hospital and could still die.
Well, a very small proportion. That's true under the existing variants as well. It's the flip side of saying 97% protection against death is that does still leave that 3% chance. That's one of the reasons why over the long term, we talk about where we want to get to with this disease as managing it like flu. People get vaccinated for flu every year as well. And it's all about getting the risks down to a manageable level and making sure that we don't see a big increase like we saw with the Kent variant. But the difference between now and December is both we've got the vaccine, which is great and protects people from hospitalisation, but also we have this amazing testing and surveillance system, so we can send in the surge testing into places like Bolton and Blackburn. 35,000 people we're trying to reach over this weekend.
Even despite that, Sage are still very worried about this reopening that is happening tomorrow. Indoor socialising, up to 6 people, pubs, restaurants, homes. I mean, exactly the kind of conditions, of course, that COVID-19 likes inside. And just looking at the latest minutes, so Sage saying that if this variant is 40 to 50% more transmissible than the Kent variant, that's what Chris Whitty suggested is very possible, then it's likely that tomorrow's changes would lead to a substantial resurgence of hospitalisations similar to or larger than previous peaks. If that is the case, why are we proceeding with the reopening tomorrow?
Well, the most important word in that sentence, and obviously I not only have seen those minutes, but I've also talked to the scientists who are following this with us and advising on it. The most important word in that sentence is if. We don't know yet the increase in transmissibility. What we do know is it is highly likely
that it's very possible that it is 50%. And surely people would understand that why don't we wait until we do know how transmissible it is, even if it's a matter of a couple of weeks?
The thing is, though, Sophie, and I know that you get this, it's often quite hard to communicate. Epidemiology is all about the balance of risks, and there are no absolutes, as our discussion just now about the protection you get from the vaccine demonstrates. If the transmissibility is as high as that, then we will have a problem. And we've been totally frank with people, and the Prime Minister, I thought, was very, very strong on Friday when he described the risks that we face from this new variant. But it may be that the increase in transmissibility is much lower. And in that case, there will be almost no impact on our roadmap and on the future number of cases. And we just don't yet know. So that's why it's appropriate to continue down the roadmap, but people need to be cautious and careful, and we're anyway moving the balance more towards people taking personal responsibility and trying to get away from some of the more intrusive rules that we've had to have in place. But of course, we also are absolutely clear that we'll do what it takes to keep the public safe as we learn more about this particular variant and about the virus overall.
So you said that if transmissibility is that high, then there will be a problem. Does that mean that even though I know that the Prime Minister has said that the changes, they want to be cautious but irreversible, may you have to row back on some of the changes that are happening tomorrow?
Well, I very much hope not. And our goal remains, as I said at the start, our goal remains, our strategy remains to take a cautious and irreversible approach to ensure that we're always looking at the data all the way through, and crucially, to use the vaccine to get us out of this pandemic.
If you're looking at the data, if you're following the data, not the dates, it would be correct to assume that the changes happening tomorrow may have to be reversed if the data says so.
Well, that's not what I'm saying. I'm saying that actually the news and the data that we have, the information we have about the variant thus far, tells us actually that our strategy remains on track. It's just that in this race between the vaccine and the variant has got some more legs. I mean, that makes it more challenging. But the overall strategy of getting us out of this by vaccinating is on track, and it's only on track, and I just really want to stress this for all of your viewers, it's only on track because of the very, very high uptake rates of the vaccine. And what's happening in Bolton right now demonstrates why it's so important for everybody to get vaccinated when the call comes, because the people who are ending up in hospital in Bolton with this new variant are largely people who are eligible for the vaccine but haven't taken the vaccine. So if you're eligible, if you're 38 years old or older, you haven't yet had your jab, please come forward now, because that is what is going to help you, but it's going to help the whole country to get out of this pandemic.
The Prime Minister has said that there could be serious disruption to stage 4 of the roadmap. That, of course, the changes planned for June, when the end of this kind of social restrictions is planned. How likely do you think that disruption is? I know it's difficult to say exactly.
Yeah, it's the question everybody's asking, and the answer is it's too early to tell. What I can do is give you a timeline, which is that we're going to monitor all of this data. There's new data coming in every single day, and then we're going to take and announce a decision on the 14th of June. As always through this pandemic, we'll be as transparent as we possibly can be with the data. You know, you can follow it all on coronavirus.gov.uk, and we'll obviously keep answering questions about our best judgment about that decision, and then we'll take it on the 14th of June. So I'm really sorry that I can't answer that question. It's because it's too early to say, and that demonstrates this, this dictum that we have, which is that we follow the data, not the dates. We'd love to take that step if it's safe to do so, but we'll keep monitoring and make sure that we keep people safe.
Understood. Would any changes happen nationally, or could we see a system where areas of the country with higher incidences of cases, hospitalisations, whichever measure, have different restrictions to elsewhere?
Yeah, well, we don't rule that out. The approach that we're taking in Bolton and in Blackburn is to absolutely pile in testing and vaccinations to try to get on top of this. You know, when we had an outbreak of the South African variant in South London last month, we put in a huge amount, hundreds of thousands of tests in surge testing. People came forward in their droves across Southwark and Lambeth and Wandsworth. We got that under control. That was the testing, tracing system working very effectively to clamp down on an outbreak. Now, we're taking the same approach in Bolton and in Blackburn. We've put in a huge amount of testing. We've reinforced that with army personnel as well. And we're expanding the vaccination programme, especially for those second jabs, which are the best protection against ending up in hospital. So at the moment, we're taking the approach that worked in South London, which is this massive surge testing. But of course, we don't rule out further action. And, you know, given though that Bolton has been in some kind of a lockdown for a year, it's not a step we'd want to take. But of course, we might have to take it, and we will if it's necessary to protect people.
Now, I want to talk to you about borders, because there's a lot of people who are looking at the situation and thinking this could have been prevented. This could have been prevented if the government had acted more quickly. So the India variant first detected in the UK in the week ending the 29th of March. On the 2nd of April, it was announced that Pakistan and Bangladesh were going on the red list. India wasn't, even though there were much higher case numbers in India. And it wasn't added to the red list until the 19th of April. It didn't actually implemented being on the red list until the 23rd of April. This really matters, doesn't it? I mean, it was too slow.
No, I mean, I've seen this argument be made in some places, and it's frankly completely wrong, and it misrepresents how these the evidence on which you can take these decisions. So, this variant was notified as a variant under investigation after we'd already put India on the red list. The decision to put India on the red list was taken because of the high positivity rate of people coming from India and looking at the epi curve in India. When we put Pakistan on the red list at the start of April, that's because the proportion of positive people testing positive coming in from Pakistan was 3 times higher the proportion coming from India. And it was only after we put India on the red list that this variant went under investigation, and then later, it was earlier this month, that it became a variant of concern.
Some will be wondering, though, it shouldn't
honest
just
truth
be about new variants, should it? The case numbers are also something that surely should be looked at. If you just look at the data from the 16th of April, for example, there are 137 daily new cases in India per 1 million people. In Pakistan, that number was 22. In Bangladesh, it was 33. And between late March and the 26th of April, 122 people arriving from Mumbai and Delhi had the Indian variant. They're just the people that we know about. Surely it was too slow.
No. So the first thing is, we have some of the strongest border measures in the world, and all of those people went through a testing regime. All of those people needed to go through a testing regime and an isolation regime. But the second point is that what matters is the positivity of people coming to this country. So you can't actually just compare those test positivity figures as you did, because it depends on the proportion of people being tested in those countries. However, because of the surveillance system we have here in the UK, because we test everybody who comes through the border, we therefore do know where the risks are. And that's why we took the action we did on Pakistan and then on India. As I say, before this was a variant under investigation. So yes, it is absolutely right that we have these tough border measures. And sometimes I get attacked for having these tough border measures, and I don't regret them at all. But you have to take decisions based on the evidence that you have. You can't take decisions based on evidence that you don't yet have. And we took the precautionary decision to put India on the red list based on the epidemic that we saw there, and then afterwards this variant was put under investigation.
And of course, you can't take decisions based on trade deals that you don't yet have either. Prime Minister due to travel to India in late April to try and secure, of course, that all-important post-Brexit trade deal. A bit tricky if India was on the red list, but I guess you're going to tell me that had nothing to do with it at all.
Well, we take these decisions based on the evidence, and we just had a discussion of the epidemiology and why we took the decisions when we did, and the fact actually that we took the decision before we knew about this variant as a variant, even under investigation, let alone it then being notified as a variant of concern.
Okay. Very quickly, is it right that you're opening up vaccinations to over 35s from tomorrow?
That is not quite right, but as you can see from the progress that we've made, we are able to, we are expanding down through the age ranges pretty rapidly. I'm 42 and I was vaccinated a couple of weeks ago. It's now open to 38-year-olds and over.
Okay, a little bit more time for me to wait then. Hopefully not too much. Not to be selfish about these things, obviously. Finally,
everybody should be enthusiastic. It's not. There's nothing wrong at all about being enthusiastic about getting your jab.
I am also just, of course, the restrictions tomorrow, some of them being lifted. How cautious should people be? Are you going to be going around hugging people yourself, or are you going to be trying to take a more cautious approach from that than that?
Well, I think we should all be careful. We all know the risks. Outside is safer than inside. So even though you can, from tomorrow, meet up inside, it's still better to meet up outside. Of course, there's people who have been yearning to have some physical contact. You should do that carefully. If you've had both jabs more than 2 weeks ago, that's much safer. So, I was asked this on Tuesday, and I said the thing I'm really looking forward to is hugging my mum. She's had 2 jabs, of course. Actually, Dad got quite upset about that. I'm really looking forward to hugging you as well, Dad. But we'll probably do it outside and keep the ventilation going, hands, face, and space. We all have a personal responsibility. We all know now the sorts of things that are riskier, but we're able, because the case numbers are so low, to move away from some of the more restrictive interventions. And anyway, I think personal responsibility is an important mantra here, because people have been so responsible through the crisis, and they've really listened and followed the guidance and the instructions that the Prime Minister's set out. And that's the approach that we should take together. But it's really good that we can take this step.
And just finally, just one more question to squeeze in. It's about the Prime Minister's holiday, because the Daily Mail reported this weekend that the Parliamentary Commissioner for Standards found he hasn't been transparent about that 2019 Caribbean holiday. It was worth more than twice the £15,000 he declared it to be. The bill hadn't been met by the Conservative donor David Ross, as the Prime Minister claimed. Whether it's luxury holidays or expensive wallpaper, why doesn't the Prime Minister just buy things that he can pay for and afford?
Well, I think, frankly, there's so many more important things. And I think that's what the voters concluded at the elections a couple of weeks ago.
Which is why we spent the majority of the interview talking about COVID and one question on this. But it is an important question.
Yeah. And I'll tell you, do you know what I'll tell you? I'll tell you what I really think, Sophie. When we were campaigning in those local elections, I knocked on one door in Middlesbrough, and this guy opened the door, and without me saying anything, he said, "You tell Boris, I don't care about wallpaper, I care about the fact you got me my jab." And that's the approach that I'm taking.
So journalists shouldn't ask politicians about whether or not the Prime Minister's broken rules? That doesn't matter?
You can ask me what you like, and I'm going to talk to you about what I'm doing and COVID. And the Prime Minister's followed the rules, we all know that. What matters for this country is getting through and out of this pandemic and making sure that we can then have a great decade in the rest of the 2020s. It's been pretty tough times. I know there's endless questions about this sort of thing, but I'm confident that the rules have been followed. And what I do is I concentrate on what's important for the nation.